Hello everyone, my name is Tori. I'm a dietitian with the Temple Bariatric Program, and today I'm going to be walking you through your post-operative meal plan for your gastric bypass or sleeve gastrectomy. If you've made it to this point, you're very close to surgery, so I just want to congratulate you. I definitely want to encourage you to keep going with your healthy changes and try to keep yourself motivated to move forward because you're almost at that point where you may be getting a surgery date, as long as you can continue with your nutrition changes and get your clearance. So the purpose of this education today is to make sure that you keep yourself safe after surgery, to allow normal healing after your surgery. We want to minimize any unpleasant side effects, prevent nutrient deficiencies that can cause long-term or permanent damage. We'll touch on vitamins, prevention of lean muscle mass, or prevention of loss of lean muscle mass rather, like losing any muscle tissue and making sure you're getting enough protein. We also want to talk about limiting calories while providing balanced meals, and that's all going to help you to keep weight off long-term after surgery. So that's a little bit of a touch on everything we're going to cover. It's definitely a lot of information, but it's all really important. So it's really great that you have the opportunity to view this online. That way you have the ability to rewatch certain areas of the video that maybe you're not understanding as well, or even rewatch it multiple times so that you fully are going into surgery with an understanding of exactly what you need to do. All right, on the next slide, we're showing a picture of the gastric bypass. At this point, you may or may not know what procedure you're having, and I can't advise you as far as that, but that is likely a conversation you're going to have with your surgeon at your next office visit. Based on your medical workup, your surgeon is going to make a recommendation for which surgery they think is better for you. The gastric bypass is a little bit more of an involved surgery. That doesn't mean it's more risky, it's just a little bit more involved. In this picture, you can see that the intestines are a little bit rearranged. So we're going to separate off a small piece of your stomach that's up at the top, that pouch of the stomach. And then the intestines are cut at the second portion down and reattached up at that pouch. I also put a link to an animation video provided by HCA East Florida. If you want to click on that link, it walks you through step by step exactly what happens during this surgery, because it's really difficult to just describe it with an animation. However, the gastric bypass is usually recommended for those who may have very severe reflux, uncontrolled diabetes, or even hernias. That's just to name a few conditions. On the next slide, on page 4, you're going to see the gastric sleeve. As you can see just right off the bat, there's a lot less going on this slide. It's a lot less complicated. What happens here, there's no rearranging of your intestines whatsoever. Everything stays put as far as that goes. Your surgeon is going to remove about 2/3 of the volume of your stomach. That part of your stomach that's removed is actually going to be removed from your abdomen. It's not staying in there, and that's why it's called the excised stomach. It's removed. Similarly to the gastric bypass, I've also included a link to a video that you can watch exactly the steps of how this surgery is done. Again, this is courtesy of HCA East Florida. We did not create this video, but I think it does a really great job of walking you through each step of the procedure. And then before we jump into the week-by-week look at your diet, I just wanted to provide you with an overview of your meal plan. This is a great piece of paper or digital document that you could save somewhere. It's a great snapshot of what your post-op diet is going to look like. It's 9 weeks back to a regular healthy diet, all the way from clear liquids to regular healthy foods. We're going to go through this step by step together today, so don't worry, you're going to know exactly what each phase of this diet looks like before you walk away today. Week 1 after your surgery is going to consist of what we call clear liquids. That's exactly what it sounds like, everything listed on slide 6. That's going to include things like water, broth of any type. Usually low sodium is preferred, especially if you have high blood pressure. Sugar-free beverages like Crystal Light, Fruit 2O, Propel Zero, really any brand that you've found that you like. Sugar-free popsicles, sugar-free Jell-O, decaf coffee or tea without any milk or creamer during the first week. You can use Splenda or other artificial sweeteners. And then an optional add-in here would be something like a clear protein drink. If you've ever used or heard of Premier Clear or Isopure, these are clear protein shake options that aren't made with milk. They're almost like Crystal Light protein beverages, and they are there for you during this period of time when you want to be on clear liquids, but you still do want to get protein. You don't need to add those in, but a lot of patients do like to do that during the first week to get a boost of protein. So that's just an optional thing for you. You do want to avoid carbonated beverages because those bubbles can cause excess air in your pouch, which is just going to be uncomfortable and it can be harmful to your new pouch or stomach. When you're in the hospital after your surgery, which is typically a one-night stay, it sometimes can be a bit longer depending on how you're feeling, and if there's any need to keep you longer, we will do so, but on average it's just a one-night stay. You're going to be told to start off drinking small amounts, usually just 1 to 2 ounces of clear liquids per hour, which is really not a lot. It's like a small medicine cup you're going to be given. So you're probably going to have a little bit of a dry mouth. You may want to bring some sugar-free mints or sugar-free candies to suck on, just so that you can take that dryness out of your mouth. And you may even want to ask if you're allowed to have any ice chips to suck on, just to get that dryness out as well. You really want to focus on taking small sips, taking your time. I know it seems like a really small amount of fluid, but your stomach is all so sensitive right after surgery that you really want to ease into things slowly. On top of that, you want to avoid gulping. So if you're someone who is a gulper right now, like you drink stuff really quickly, you can chug a bottle of water really quickly, I want you to start really focusing on noticing when you're doing that. That way, you're going to kind of start to break that habit. If you gulp or chug stuff after surgery, that's going to cause you to swallow extra air, and that's just not going to feel really comfortable. So again, the commonality here is we just want to make you feel or keep you feeling comfortable after your surgery. And then the last note is not using straws to drink. Again, that one's not like the end-all be-all. It could make you swallow air. It's not a lifelong thing. It's just best to avoid using straws in the first couple of weeks after your surgery. When you go home, you're going to increase your fluid intake. And you're going to increase that fluid intake to a goal of somewhere between 3 to 8 ounces each hour. And the reason that jumps up right when you get home is that when you're in the hospital, you're on IV fluids. So you can kind of get away with only drinking a small amount, but you're still hydrated. When you go home, we don't have you on IV fluids anymore. So you got to get that by mouth. So if you're drinking somewhere in the range of 3 to 8 ounces each hour, but stopping when you're full, that's our goal. One person might drink 3 ounces and feel completely full. They can't drink another sip. That's fine. But another person may drink 5 ounces, and then that's when they feel full. So that's really the reason for that range there, is we don't want to tell you to stop at 3 ounces if you're capable of 5 ounces before you feel full. So you really got to listen to your body at that point. Another note is just to not drink more than 8 ounces of liquids per hour. I very rarely have any problems with this. Very rarely patients even meet 8 ounces of liquids per hour. The bottom line is you want to be trying to get enough fluid, but stopping when you're full. The next slide is showing you an example schedule. This schedule may look different for you depending on what your schedule looks like, when you wake up, when you go to sleep, all of the things that you do throughout the day. It doesn't have to look exactly like this. What this is showing you is hour by hour, you want to be drinking something every hour. Again, really straightforward, just somewhere between 3 to 8 ounces of any liquid. It could be water all day. It doesn't doesn't have to be hot tea. It doesn't have to be Crystal Light. As long as you're getting fluid, that's what we're most concerned about. So as long as you're getting some sort of fluid, water, Crystal Light, it can be the same thing all day. Pick and choose what you like and stick with that all day. Another good thing to note is monitoring the color of your urine. I usually ask about this at your first post-op visit, and it's kind of a funny question. I know it's a little bit of a weird question. If you notice your urine is really dark, and it usually is right after surgery and or first thing in the morning when you wake up, that should be a reminder to try to drink a little bit more. The goal is to get that urine to look light yellow, closer to like a lemonade color if possible. This one's a little tricky because all of those options are accurate statements. However, if you answered B, that was the most important thing listed there. Staying hydrated is the most important thing during week 1 because dehydration is the #1 reason for readmission after bariatric surgery. So if we can prevent that by really staying on top of your fluid intake, that's going to make the biggest difference in your first week after surgery. You're going to be instructed to start week 2 of your diet at your first post-op appointment. That's going to occur about a week after your surgery. At that time, you're going to see your surgeon and a dietitian to check in, see how you're doing, and kind of talk about next steps, not only in your diet, but in your healing process too. So from a diet standpoint, what we'll be talking about is starting protein shakes, the whey isolate protein shakes, which we'll talk about in just a minute here. It's typically coming in the form of a protein powder, so you can mix that with milk, either skim or 1% cow's milk, unsweetened soy or almond milk, fat-free lactate milk, or straight up water if you prefer. You can also add strained low-fat cream soups. So examples would be something like 98% fat-free cream of mushroom, cream of chicken. You just want to strain out the chunks or pieces in the soup itself. You can also have tomato soup, original V8 juice, just not the fusion or splash type, low-fat, low-sugar yogurt, preferably not with like the fruit on the bottom or lots of chunks and seeds in it. And you can also have sugar-free, fat-free pudding. If you're preparing it on your own, you just want to prepare it with skim milk. And these are all in addition to your options from week 1. So, of course, continue to drink plenty of water, Crystal Light, tea, and things of that nature. So the goal of week 2 is really to start adding protein into your diet. Yes, there was an option for clear protein drinks during week 1. However, this is really the catalyst for adding protein into your diet is this week. Keep in mind that all of these week 2 liquids are thicker than what you were drinking before. So a really easy example is like pudding is obviously thicker than water. So it's going to fill you up more quickly than water would. So it might be possible that you're only going to be able to drink 2 ounces of, or eat 2 ounces of pudding if you were drinking 3 or 4 ounces of water. And that's okay. That's to be expected. This is an example day of week 2. Kind of the same idea as the first week. However, you'll see the major difference here is that at 8 o'clock, 12 o'clock, and 5 o'clock, you have 8 ounces of a protein shake, and more or less that's going to be your meal during this week, or your meals during this week. You may not be able to drink 3 protein shakes right off the bat immediately, but you can work your way up to the 2 to 3 shakes a day. On this slide here, there's a box to show you what your goal for your protein needs after surgery is. We'll tell you that at your next office visit. That's solely based on your gender and your height. On average, our patients need somewhere between 60 to 80 grams per day, sometimes up to 100 grams per day if you're a taller male. So again, we'll advise you as far as your specific protein goal at your next visit. What we're talking about here is the type of protein we want you to purchase. In a perfect world, all of our patients would be using whey protein isolate. That would be the first ingredient listed on the nutrition label. We want you to avoid powders where the first ingredient is whey concentrate or whey blend. That's going to be the ingredient in things like Slim Fast or Premier. That's just a lesser quality of protein. It's going to be a little harder for your stomach to absorb after surgery. This next page is just showing common brands of whey isolate powders. This is not all inclusive. There are tons of protein powder brands out there, but this is just giving you an idea of different brands, different locations of where you can purchase it. And then lastly, on the next page, just some links for sampling protein powders. A couple of these links offer sample packs of, for inexpensive prices, you can order a couple sample packs of different flavors, different brands, and I highly recommend that just so you can get exposed to different options. We do have some options for samples available in the office, but not as many as you're going to be able to get from a sample pack ordered online. So I would highly encourage you to do something like this, or to go to a store that sells samples like a Vitamin Shop or GNC and try to get your hands on some different things to try. If you answered letter C, whey isolate, that is the best answer. However, if you're someone who doesn't happen to do well with the whey isolate protein powder, whether it makes you nauseous or you can't find one that tastes good to you, we can certainly discuss other options as far as protein powders or protein shakes. The reason that the whey isolate is most recommended is because it's the highest in concentration of protein, and it's proven to be the best absorbed protein powder after bariatric surgery. Not to mention that it's the lowest in concentration of lactose, so it is technically the easiest one to absorb, but that may be different from patient to patient. So again, if you do have issues finding one that you like or tolerate, we can talk about other options. During weeks 3 to 4 after your surgery, you're going to be on what's called a pourable protein diet, or more simply put, a baby food diet. So you're going to be using a blender for this stage to make a pureed or baby food texture consistency for foods. Your goal is to eat 2 ounces or a quarter cup of these blended pourable foods 3 times a day, and you are going to continue to have your protein shakes to meet your protein needs. Keep in mind that you may only be able to tolerate or stomach 1, maybe 2 tablespoons at a time at first, and that's okay. We still want you to stop and listen to your body when you're full, and that might mean stopping before you reach that quarter cup serving size. On the next slide here, we are showing you all of the examples of what a pourable protein is. And so if anyone out there has ever made baby foods before, that's exactly what we're asking you to do for yourself. However, we want all of those foods to be high protein foods. So at this point, no fruits or vegetables or starches. We want them all to be protein-based foods. Things like scrambled eggs, beans, tuna, chicken. All of these foods should be cooked and placed in a blender with a small amount of liquid, enough to help it blend. And usually what we recommend, depending on your blender model and size, is enough fluid to cover the blades. And also, depending on what type of food you're having, you can alter the type of liquid that you're using. So you might use broth for chicken and skim milk when you're blending eggs, and kind of vary it that way. Your other option, if you really don't want to mess around with making your own pureed foods, you can stick with your week 2 proteins that we just reviewed not too long ago, the low-fat, sugar-free yogurts, your protein shakes. Ultimately, at the end of the day, if you're getting enough protein from protein shakes, you're getting enough fluid, you're not going to put yourself in harm's way. Or you can opt to do stage 1 baby food meats that are already prepared. You can buy those in the store, and you want to stick with stage 1 baby food meats. Now, I realize these are not the most elaborate or most, gourmet recipes that we've put on this page. At the bottom of the page, I also included a link for the Bariatric Foodie blog. She archives recipes, so I included a link for all of her pureed diet recipes, which some of them actually look really appetizing and really exciting at the point when, you've been on protein shakes for so long, you might be a little bit more ready to try some of these things. The next slide goes into the details about making foods the right consistency or making them pourable. Like I said, you really want to make sure you're cooking the food first, cutting it into small pieces, putting it in a blender. So you want to make sure you have a blender before this stage, unless you're going to opt to purchase baby foods. Adding enough liquid to cover the blades and blending it until it's smooth. If there are any stubborn pieces like lumps or seeds or anything that won't blend properly, you want to remove that from the blender. The other thing is seasonings. I get that question a lot. Yes, you can season things. You just want to be mindful not to heavily season things too much or use anything overly spicy that could irritate your stomach at this point. All right, and then here's an example day of weeks 3 and 4. It's looking very similar to what it has in the past week. Really, the big differentiating factor here is that instead of protein shakes at meal times now, so instead of having a protein shake at 8 a.m., you're having a blended protein meal. So in this case, we opted to have something like a quarter cup of egg beaters or like blended scrambled eggs. You still are having your protein shakes. They're just a little bit offset from that blended meal. So in this case, we've waited an hour and a half to allow your stomach some time to digest that meal, but it's going to be a little bit different for everyone. So don't feel like if you can't follow this schedule exactly that you're not doing well. You also want to note the total amount of protein for this day is 95 grams of protein. If your specific protein goal or your personal protein goal is only 60 grams, you don't need all of this stuff on this schedule. So that's where the individual, our individual conversations in the office will be really helpful for some of you. Week 5 is essentially the same thing. So week 5 is still doing a blended pourable protein, about a quarter cup, and you do want to prioritize that and eat that first at all meals. The second option at your meals now is only if you have room, you can add a quarter cup of a pourable fruit or vegetable. Examples are listed down below. So something like a quarter cup of unsweetened applesauce, or a quarter cup of well-cooked carrots that you've blended into a puree, or even something like a quarter cup of mashed sweet potato or mashed potato thinned with a little bit of broth or milk. Those things are fine to add, but you do want to make sure you're having your protein source first before adding in those other things. We really do want to prioritize that small space in your stomach for protein, not only now at week 5, but really lifelong. This was a little bit of a tricky question, but if you answered A, blended carrots. That was the correct answer. The reason this one is not an example of a pourable protein is simply because it's not a protein-based food. It's a vegetable. So you would be able to add this food as a second option to your menu during week 5, but it's not technically a pourable protein. During week 6 through 8, you're going to be eating foods that you can easily mash with your fork. We'll show examples on the next page of what exactly that includes. You want to make sure you're starting out slowly. Eventually, you want to try to work up to first eating about a quarter cup or 2 ounces of a protein food, and then adding, only if you have room, a quarter cup or 2 ounces of other foods. Again, the next slide outlines the specifics of what we're talking about. So as far as protein foods that are easily fork mashable, things like finely chopped canned tuna mixed with low-fat mayo, finely chopped veggie burgers, flaky moist fish, moist lean ground meats, low-fat dairy products, eggs, beans, lots of options open up as far as your protein foods. Now your other foods, you can have steamed soft vegetables, a boiled or mashed potato without butter and without the skin. You can have soft ripe fruits without the skin or seeds, for example, applesauce that's unsweetened, ripe banana, or even canned fruit in its own juice. And the newest addition in this couple of weeks of your diet is the addition of cooked cereal without sugar, so you can have things like cream of wheat, oatmeal, farina, and a tip is to even add a scoop of protein powder to make that a protein food. Therefore, that could be your meal. And again, your sample day is outlined here on this slide. At this point, the only difference is the texture of your meals. Everything else stays the same as far as the amount that you're drinking, the number of protein shakes you're having, when you're eating. The major difference here is really just that you're going from a blended consistency from weeks 3 through 5. Now you're having easily fork mashable or easily chewed foods. If you answered false, you're correct. You cannot eat raw fruits and vegetables during this phase of your diet. However, you can eat soft steamed vegetables that are fork mashable and soft ripe fruits like ripe bananas, unsweetened applesauce, and canned fruit in its own juice. Once you've reached 9 weeks after your surgery, you're going to resume a regular, healthy diet. What that means is you're going to be allowed to eat regular texture foods, like it doesn't have to be soft or mashed foods by any means. You can have things like regular consistency protein, such as chicken breast, turkey breast, and other meats that are not ground, as well as raw, crunchy vegetables and crunchy fruits. I do recommend adding one new food at a time during this transition to regular foods. That way, if you have some sort of negative reaction like stomach ache or stomach cramping, nausea, anything of that sort, you're going to be able to pinpoint exactly what food caused that reaction. Even though you're on a regular diet, you do want to continue with your healthy habits, such as eating 3 meals a day with about 4 ounces of food per meal. It may end up being a little bit less than that for you based on how much your body or your new pouch can tolerate, but no more than about a half of a cup per meal. You want to prioritize your protein foods first. So for instance, eating something like chicken or eggs always first at your meal, followed by a vegetable or fruit for the best results with weight loss. That doesn't mean you can't ever eat a starch like rice or bread. It just shouldn't be the go-to or your norm to pair with proteins. Foods should continue to be moist. Ways that you want to achieve this is using things like low-fat gravies, adding extra broth to add moisture, especially if you're reheating things in a microwave. That can dry things out. This is especially relevant when it comes to your meat proteins. Those are going to be the most difficult for your new stomach to break down. So you want to make sure to avoid eating overly dry or rubbery texture meats. Trying to eat when you're relaxed and eating slowly. Continuing to chew your food extremely well. The recommendation is to chew your food to applesauce texture before swallowing. That's going to give you the best digestion and the least complications after your surgery. In addition, you want to keep your liquids separate from meals. We'll talk a lot more about the details of why we recommend this in a little bit, but you want to not be drinking anything for 30 minutes before your meals, during meals, and 30 minutes after you've finished the meal. So that's going to be at least an hour of time surrounding your meal that you should not be drinking any liquid. And then, of course, my biggest takeaway, I hope that you're taking something else away from today's class, but what I normally say is if you don't take anything else away from today's class, if you can remember to stop when you feel full and listen to your body, that is one of the most helpful things that you can do after your surgery. The next few slides are tables of foods allowed and foods to avoid on a regular diet. I'm not going to go through every single line of this information, but I'm going to pinpoint some of the most commonly asked questions when I have an in-person class. So what you'll see if you take a moment even to pause this video just to look over this, you may notice a couple of common themes. The first thing is that all of the things in the foods to avoid list tend to either be high in fat or high in sugar. So for example, looking at the first category, your meats or protein sources, in the foods to avoid list, you'll see a lot of breakfast meats like scrapple, bacon, sausage, hot dogs. However, if you look at what's allowed or more appropriate for after your bariatric surgery, you'll see things like turkey products. So that would include turkey bacon, turkey sausage. All of those lower fat meat alternatives would be acceptable. Same idea with your dairy. You want to choose lower fat dairy products if you tolerate dairy to begin with. If you're lactose intolerant, you would be omitting this category. When it comes to peanut butter, you want to limit that to no more than 1 tablespoon a day because it is very high in calories for a small amount. On the next slide, we'll go into vegetables. Most vegetables are okay. You just want to avoid any vegetables that might be extremely fibrous. What I mean by that is things like raw celery that have a lot of string or fiber. That's going to be really difficult for your stomach to break down after surgery. When in doubt, cook a vegetable. You're always going to tolerate it much better cooked than raw. Fruit, kind of the same idea. You want to avoid the cores, the seeds, anything that's going to be too difficult for your stomach to break down. Moving on to the next slide, we're going to hit those categories, breads and starches. Again, I'm not going to tell you you can't ever have breads or starches again. However, it should be in very limited quantities. These things are going to fill your stomach up the most. When you eat a piece of bread or something that's doughy and starchy, it expands by absorbing liquid in your stomach. After your surgery, that can be A, extremely painful and uncomfortable, but B, over time, eating large amounts of starches can eventually stretch out your pouch, which can cause weight regain. So you definitely want to make sure you're not eating a ton of starches in the first place, but if you do, trying to do things like crackers or toasted bread, those are all going to expand a lot less in your stomach. On the next slide, it's a bit of a summary of the charts that we just looked at. The biggest difference you're going to see here, or the main difference here on this slide is going to be it's telling you to use caution with things like dry, tough beef or pork. We'll jump into that a little bit more in the next slide as well. We just talked about soft, doughy breads and pasta and rice and why to use caution with those. Otherwise, these other foods listed are all pretty consistent with the charts that we just looked at, but this is a good one-page summary if you're looking to have something printed out and posted somewhere, like on your fridge or something. Here on slide 37, there's tips on moist cooking methods. So I mentioned that certain types of meat can dry out very easily, therefore making them really hard for your stomach to break down, which can cause pain or discomfort. Moist cooking methods are going to prevent that from happening quite as much. So things like pressure cookers and crock pots, stewing or braising, simmering, pot roasting, all of these cooking methods are going to make sure that the meat you're preparing is nice and moist. You want to avoid things like, not totally, but you want to try to be careful when you're reheating things in the microwave or you're grilling. Those methods can dry things out really easily, and it might not feel as easy to break down in your stomach. On this slide here, slide 38, we're going to jump more into the eating and drinking guidelines and why you should be separating those two things. So again, just to reiterate, you want to drink liquids separate from eating food. You should not be drinking for 30 minutes before your meal, during, or 30 minutes after your meal. This is for a couple of reasons. So first of all, drinking with your meals can liquefy the food in your stomach, which can make it be flushed. It can make the food flush through your pouch quicker. That can cause you to feel hungry sooner and eventually lead to overeating and weight gain. So it's a little bit more, we're going to jump into dumping syndrome in just a moment here. Dumping syndrome is much more common for someone with a gastric bypass. If you're getting a sleeve or you ultimately end up getting a sleeve, I still want you to abide by these guidelines because it's going to prevent your stomach from feeling overly full and just uncomfortable. Most people have at least heard of the term dumping syndrome. If you haven't, that's okay. Dumping syndrome is a feeling of fullness and cramping. It can eventually lead to diarrhea and lightheadedness. Generally, what I hear is it's just an unpleasant thing to experience, and if you experience it once, you typically try to avoid it from there on out. So there are a couple reasons why you might experience dumping syndrome. And again, it's more common for someone who gets a gastric bypass. The three reasons are if you eat something high in fat, for example, that like regular pork bacon, something high in sugar, like soda or ice cream. Those high fat and high sugar foods are going to pass too quickly from your stomach or your pouch into your intestines. And that's going to cause a number of different reactions that your body's going to have that cause the lightheadedness, the diarrhea, the low blood sugar, all of those things. The third reason that it can happen is if you eat and drink at the same time. So again, that's another reason we want you to avoid the eating and drinking at the same time, is really to prevent all of these unpleasant side effects from happening. Slide 40 has other words for added sugar on a nutrition label, or on the ingredients label rather. You definitely don't need to know these by heart. They are helpful to generally have an idea of. When in doubt, the best way to find out the grams of sugar on a nutrition label are to look at the total grams of sugar, to look at that number. However, if you look at an ingredients list and see that the first thing listed is fructose or high fructose corn syrup or any of the things listed on this slide, it's pretty safe to say that that's going to be a very high sugar food. This is just showing you that sugar isn't always going to be labeled as sugar on a nutrition label or on an ingredients list. And then very lastly, to wrap up the dumping syndrome section, reactive hypoglycemia is the low blood sugar that you might experience as a result of dumping syndrome. Reactive hypoglycemia, again, you don't need to know this term, but it's a severe or very quick drop in blood sugar within a few hours of eating a high sugar meal. So for instance, a patient might eat something high in carbohydrates or high in sugar like cake or ice cream, for instance. Their sugar is going to spike, and then it's going to drop really quickly within the next couple of hours after that food was eaten. So basically what your body does is it overreacts and it releases too much insulin, and it releases too much insulin from your pancreas and therefore removes too much sugar from your blood, which causes your blood sugar to go low. So you want to prevent this, because if you've ever experienced a low blood sugar before, you know other things can happen along with that, such as shaking, headache, sweating, feeling tired, weakness, hunger, a whole number of different things that are just not very pleasant. So if we can avoid the 3 core reasons that dumping syndrome would happen, which is eating high sugar foods, eating high fat foods, and eating and drinking at the same time, we can hopefully prevent these symptoms from happening. There are some other tips on this slide of how to prevent dumping syndrome, like avoiding eating high carb foods on their own, always including a protein source with each meal, limiting portion sizes. Those are all very helpful ideas as well, but it comes back to the main idea that if you're avoiding those 3 triggers, the fat, the sugar, and eating and drinking at the same time, you can avoid these side effects from happening. If you answered all of the above for this question, that is correct. All 3 of those things may cause dumping syndrome, as previously discussed in the last section. Moving into arguably one of the most important topics of today's class is vitamins and minerals. It's really essential that you know it's necessary to take vitamin supplements for the rest of your life to avoid nutrition deficiencies. You'll see on this page that there are some long-term or permanent complications of nutrient deficiencies listed below. I'm not going to go through each one of them, but it's something to be taken seriously because it is fully preventable if you are taking the correct vitamin supplements. So just picking on something random, I think if we can avoid permanent paralysis from a low vitamin B1 level by taking vitamins, most of us would choose to do that. For the first 3 months after your surgery, your supplements should all be chewable or liquid, no gummies. That's really important because gummies aren't going to be broken down as well, they don't dissolve as easily, and also they tend to not have as much iron in them. So we're going to make recommendations as far as specific vitamins that you should be taking, but on this page here, there's a quick list of the vitamins that are recommended for patients after bariatric surgery. So I'll go into the details of that shortly. I like to just show this visual to kind of point out the key differences between taking bariatric branded vitamins, or sometimes referred to as bariatric specific vitamins, versus over-the-counter vitamins. So on your left-hand side, you're going to see, and it doesn't necessarily need to be this brand, but you'll see the Bariatric Advantage brand of vitamins. In order to meet your needs as a post-operative bariatric patient or after surgery, you need to take 2 chewable multivitamins and 3 calcium chews spread throughout the day. That's it. Just those 2 separate things. On the other hand, if you choose to go with over-the-counter vitamins, because they aren't designed for bariatric patients, you kind of have to piecemeal a bunch of different things together to meet your needs. So you'll see the Flintstones are listed. That's going to be your chewable multivitamin. You also need a B complex or vitamin B1 for additional thiamine. You need additional vitamin D to get enough of that. You need additional vitamin B12 and usually additional iron. Not to mention the calcium that's recommended that you take in 3 separate doses throughout the day. So again, this is just a visual to show you the convenience and the number of supplements you could be saving yourself if you do go with the bariatric options, and that is what we recommend, just really for ease of use, not having to buy so many supplements, and not to mention having to remember to take so many supplements. The first day you go home after surgery, it's recommended that you start taking your chewable multivitamin, multimineral with iron. So we just spoke about the fact that I highly recommend a bariatric brand. The brand that we carry in the pharmacy is Bariatric Advantage, and we're very soon going to start carrying Celebrate, which is another bariatric brand. Both of these brands can also be purchased online from their websites, but these are great brands because they have iron, they have the correct amounts of B1, B12, and vitamin D that you need, that you won't need to be buying extra supplements to go with it to make sure that you're getting enough. So that's really helpful, and that's highly recommended. You'll need to take 2 of those chewables in the morning. A helpful tip that after 3 months, you can switch to a regular tablet form of a multivitamin if you'd like. That means if you get tired of the chewable or you just prefer to swallow a pill, 3 months after your surgery, you can switch to that type of vitamin, and these brands do carry just pill or tablet forms as well. Another important part about your multivitamin is you want to make sure to not take your calcium at the same time. The reason for that is it's going to cause absorption issues, so it's better to space out your multivitamin and your calcium, or any supplement with iron for that matter, and calcium. We recommend separating them by at least 2 hours. At the end of this section, I'll show you a schedule that's pretty easy to follow to make it work out correctly. The second thing that you're going to need, regardless of if you buy a bariatric specific vitamin or not, is calcium citrate. You're going to need between 1,200 to 1,500 milligrams per day, and this is going to be taken in 3 separate doses, at least 2 hours after any supplement with iron. In this case, what we were just talking about is your multivitamin. So the reason you have to separate it into 3 doses is our bodies are only capable of absorbing 500 milligrams of calcium at a time. So if you try to take all 1,500 milligrams at once, it's just not all going to be absorbed. So if you break it down into 3 separate doses, that's going to be the best way to absorb it. We typically recommend lunch, dinner, and bedtime just for ease of use, but again, that's going to be on that schedule at the very end of this section. It's recommended to start taking your calcium citrate a week after your bariatric surgery. That's because you're going to be taking Tums the first week after your surgery, and I'll show you exactly how that works in a moment. There are tons of different brands of calcium, bariatric, non-bariatric. It's not as important for this supplement that you buy a bariatric brand. However, many people prefer to buy the bariatric brands because they come in nice chewable forms. They tend to be a little bit easier to use. They tend to be a little bit higher dosages than some of the liquids and other chewables out there. So definitely look at your options and see what you think would work best for you. But many of our patients like the bariatric branded ones. And here's just some pictures of all of the different brands. It just goes to show there's a lot of options out there. The 2 bags you'll see are the 2 separate bariatric brands, the Bariatric Advantage and the Celebrate. The really nice thing about these vitamins, in my opinion, is that they are individually wrapped. And what that means is you can just kind of grab a handful, throw them in your purse, your desk drawer, wherever you need them. They're going to be easily accessible, as opposed to having to take or deal with a fluid or a liquid calcium. That's a little bit more finicky in my opinion. But again, to each their own, you got to figure out what's going to work best for you. The next 2 pages are going through vitamins that you don't need to purchase if you buy a bariatric vitamin. Meaning, if you buy a Bariatric Advantage or Celebrate brand of chewable multivitamin, you do not need to buy these extra vitamins like the B12 and the B1, the D, and the iron. However, these are here for those people who choose to not buy the bariatric brand for whatever reason that may be, whether it be financial or, just a personal preference. or whatever, these are the things that you're going to need to add in addition to your multivitamin. So the first thing is vitamin B12. Your multivitamin, I'm going to use Flintstones chewable as an example throughout, but just know if you're not taking a bariatric branded vitamin, I'm referring to that vitamin throughout. So your Flintstones is not going to give you enough B12 as a bariatric patient. Your needs are much higher. So you're going to need to buy additional vitamin B12 in a sublingual form. What that means is it dissolves under your tongue. This is going to begin a week after your surgery. You also can get a monthly shot from your doctor's office. We don't offer that in our office, but you can ask your primary care doctor if that's available through their office and if they're willing to do it. The recommended doses and the frequency are listed towards the bottom or the last bullet under the B12. Most people like to take 500 micrograms every day just because it's the easiest to remember, but there are different options there for you. Vitamin B1, also known as thiamine, again, you're going to need to buy additional amounts of that because there's not enough in the Flintstones. You can buy this in a couple of different forms. You may find it branded as just vitamin B1, or you may even find it branded as a B complex vitamin. As long as it has somewhere between 12 to 100 milligrams of vitamin B1 or thiamine, which are the same thing, that's what we're looking for. Vitamin D, this is another thing you'll have to add to the non-bariatric vitamin. There are tons of chewable vitamin Ds out there, so there are just a few different options listed here on this page. It doesn't necessarily matter what brand, but it should definitely be chewable or liquid for the first 3 months. And you're going to need 3,000 units per day. And lastly, iron. Most people are going to need to add additional iron, especially because your Flintstones only has 18 milligrams of iron in 2 chewables. So you're going to need to add extra iron. Especially if you're someone who gets a gastric bypass, you're going to want to get closer to 65 milligrams of iron per day. If you get a sleeve, you can probably get away with somewhere around 45 milligrams. Based on your history, we can talk about what might be the appropriate amount of iron for you in the office one-on-one. So again, there are some different brands listed below. And again, it doesn't matter specifically what brand you get, just that you're getting enough there. So those last 4 things we just went through are the additional amounts of vitamins that you'll need to supplement if you don't buy a bariatric branded multivitamin. I mentioned Tums earlier, so this here is showing you in the first week after your surgery what you'll be taking as far as your supplements. In the morning, starting the first day after surgery, you're going to take 2 of your chewable bariatric vitamins, whether that's the Celebrate brand or the Bariatric Advantage brand, it doesn't matter. It's just whatever brand that you choose to purchase, along with 2 chewable Tums at noon and 2 chewable Tums in the afternoon or evening. Once you come in for your first post-op appointment, which is a week after your surgery, we are going to advise you to stop with the Tums and start with your calcium citrate at lunch, dinner, and bedtime. So on slide 53, this is showing you the difference between example number 1, the over-the-counter generic vitamins, versus example number 2, which is the bariatric specific vitamins. So up at the top, you're going to see, like with the Flintstones, you have a number of different vitamins you're going to have to take in the morning. So your Flintstones, your B complex, your D, vitamin B12, and iron. So up to 5 different supplements in the morning, and calcium at lunch, dinner, and bedtime. As opposed to example number 2, if you choose to do the Celebrate or Bariatric Advantage brand, you're going to be taking 2 chewable multivitamins of whichever brand you decide to purchase, along with a chewable calcium at lunch, dinner, and bedtime, and that's it. So it makes things a lot more simple in terms of taking it, but also in terms of keeping stock of your vitamins and when you need to refill and keeping the appropriate amounts of each vitamin on hand for yourself. If you answered B, 3 times per day separated from your multivitamin or any other supplement with iron, this is correct. Remember that calcium and iron do not absorb well together, so we want to separate any supplement with iron, in this case your multivitamin, from any supplement with calcium. If you guessed A, 3 months after your surgery, that is the correct answer. We want to protect those fresh incisions after your surgery. So by swallowing anything whole, like a big vitamin supplement or a big mineral like a calcium, that's going to put your stomach at harm's way. So we want you to wait at least 3 months to swallow any vitamins in a whole tablet or capsule form. This may look different for your medications, which your doctor will speak to you about. Now that we've presented all of the information as far as what diets you're going to follow at which weeks, all of the vitamins, your protein goals, everything as far as that goes, I'm just going to go through the last information as far as tips and lifelong guidelines to keep you safe and successful after your bariatric surgery. So you definitely want to continue to pay attention to your fullness. You want to be extra cautious to not overeat, especially in that period of time while you're still healing from your surgery. You want to be especially cautious in the first couple of months after your bariatric surgery because you don't want to put excess pressure on your stomach while it is still healing from the operation. Once you get back to week 9, and I think we talked about this a bit earlier, or once you get back to a regular diet, which is 9 weeks after your surgery, you want to add one new food at a time. This isn't an attempt to really make sure that any food that you have a negative reaction to, we're not unnecessarily eliminating that food just because something else bothered your stomach along with it. You do want to try to avoid distractions as much as possible while you're eating, so that way you can be eating mindfully and check in with your stomach, check in with your emotions while you are eating. Many patients do report using like baby or kid spoons, smaller bowls, sippy cups, smaller utensils, plates, all different types of plates and spoons. So that way you don't feel like you're eating such a small portion. So that's always an option that's there for you if you don't want to be eating a quarter cup portion off of a huge dinner plate. You could always opt to use baby plates, bowls, or kids' bowls. You can always weigh and measure your foods using a food scale or measuring cups if you're not confident in your ability to eyeball your portion sizes. I definitely suggest doing this periodically just to make sure that your portion sizes aren't getting skewed or getting larger over time. And you definitely want to make sure your meals are kept to about 4 ounces or half a cup, making sure to prioritize protein for about 3 ounces of that meal. And you'll slowly increase to about 3/4 of a cup of total food at meals as tolerated. I'll show you in a little bit what a menu may look like a year after surgery. You do want to try to plan nutritionally balanced meals. Again, for you as a bariatric patient, that's going to look very high in protein, and that may mean omitting some fruits and vegetables for quite a while. You do want to avoid high sugar and high fat foods to prevent dumping syndrome and to provide the best weight loss possible. Avoiding really fibrous foods, what I think of in this category is like raw celery, raw cabbage, really tough, fibrous, raw vegetables. These things, are just probably not going to feel that great going down, but they could possibly get stuck and cause a blockage. I don't hear of that too often, but it is definitely a possibility. You want to try to avoid any mindless snacking. I don't fully agree with avoiding snacking altogether. For most of my patients, their day is going to look like 5 to 6 small meals per day because it's so hard to meet your protein goals in three small meals. So the key here is being smart with your snacking, choosing 100-calorie high protein snacks, which we can give you a list of, trying to avoid any like high carb, pretzels, chips, typical snack foods. You do want to chew all of your foods really well until they're liquefied, until applesauce consistency in your mouth before swallowing. Really taking your time when eating, making your meals last about 20 to 30 minutes, and really logging your food, writing foods down in a log so you can track any food intolerances you may be experiencing, along with tracking your protein intake and your water consumption. This slide here shows what a sample menu may look like a year after surgery. I think this is really helpful to see right here and now at this point in the process, because I know it can be intimidating to have all of these planned diets ahead of you of, liquid diets, pureed diets, soft diets. I promise you your diet will get back to a pretty normal point. It's just going to take some time. So if this helps to give you some light at the end of the tunnel, then let it be that for you. As far as lifelong guidelines go, meals should take 30 minutes. You want to keep your meals to about 6 ounces or 3/4 of a cup total. You want about 3 ounces of this to be protein. Liquids should be 30 minutes before and 30 minutes after your meals, not during those times, to prevent dumping syndrome and overfilling. You definitely want to stop eating at your first sign of fullness to prevent overeating and over time stretching of your pouch. You can have protein-based snacks if your meals are far apart, and I find that these come into play in the couple of months after your surgery because you're filling up very quickly, so you need to have those more small, frequent meals. Be aware of what and when you are eating. Consider using a food log like we just talked about. Definitely avoiding calorie-containing beverages, trying new foods periodically, and of course being physically active for 30 to 45 minutes most days to help keep that weight off. As far as exercise goes, during the 6 weeks after your surgery, you're going to be on a restriction. So during that first 6 weeks after surgery, you're not going to be wanting to lift anything greater than 10 to 15 pounds. However, we are going to encourage you to walk regularly. That's going to help to prevent blood clots. It's also going to help with healing and just generally keeping blood flow in your body. After that 6-week healing period, up until 6 months after your surgery, we encourage daily physical activity. Something looking like, aerobic exercise 3 to 4 days per week for at least 30 minutes per session. That could be walking to start off with. And then we do definitely encourage incorporating some toning exercises with light weights to start. After that period of time, so 6 months and greater after your surgery, we want that to be increased because your body's going to start to get used to that routine. We want your aerobic exercise to increase to 4 to 5 days a week, to a goal of 45 minutes per session as opposed to 30 minutes per session, and continuing to tone with light weights. The toning exercises are going to be very helpful for reducing the impact of any loose skin that you may have. It's not going to eliminate that factor completely, but it definitely is helpful in reducing the amount of loose skin that a person may have. This concludes the postoperative nutrition education for the sleeve gastrectomy and the gastric bypass. Please continue to review this video, come back to it, review the paperwork that you have, because we want you to feel as confident as possible going into your new lifestyle after surgery. You are going to have the opportunity to speak with a dietitian at your next office visit to truly indicate if you are nutritionally cleared or if we're still working towards some nutrition goals. At that time, you'll have the opportunity to ask any questions that you have based on today's presentation. So please write down anything that you're confused about or any questions that you may have at this point. A lot of patients ask what they can start to do to prepare themselves for surgery after this visit. One of the best things that you can do is start to consider what vitamins you're going to purchase and maybe consider starting to tack away at that shopping list. We do sell the bariatric vitamins in our outpatient pharmacy, and you may also want to consider what protein powder you're going to use for after surgery as well. So if you do have any other pressing questions, you can contact the office. Otherwise, we will see you at your next office visit, and have a great day.